Eh bien, bonjour à tous et merci
Good
de vous être
afternoon, everyone, and thank you very much for being connected for our webinar today. This has been organized by the governmental platform for the mobilization of interior public resources that FEDI is part of. My name is Anne-Marie Georgeon. I'm the co-director of the Taxation for Development program at FEDI, and I will be your moderator for this afternoon. The webinar of today is going to be looking at excise duties and health. This is actually a complementary webinar to one that has already been organized by the platform for the socioeconomical impacts of indirect taxation. Why? Because here we're going to go one step further with regards to the objective of mobilizing tax revenue. Today we have four different speakers that will be taking the floor, and I will be introducing them one after the other in due course. But prior to this, we will have a quick intro to the webinar so that we can set the scene and so that you can maybe whet your appetite with regards to excise tax. Anouk, you have the floor.
Merci Anne-Marie, bonjour à
Thank you
tous.
very much. Good
Donc,
afternoon,
comme tu l'as
everyone. So, as was mentioned by Anne-Marie, I will start with a quick
présenté comme
introduction
mobilisation,
so that we can maybe set
donc
the scene for
tout d'abord
excise
l'excise, c'est
duties
une
and tax.
action développée
Excise duties are
pour taxer la
indirect taxes
consommation.
looking to tax
C'est une contribution
consumption.
directe sur des
They
produits
apply
à
to
l'importation
infinite
totale ou
products that
limitée.
are imported
La
as well
taxe
as
est
interior
décidée par les
products.
pouvoirs publics
This is something that is decided by public
et
authorities and
directement sur
then
les consommateurs.
brought
C'est un
in on
mode
consumer prices. This means that
contributif.
there is an increase of
Les
prices for
déductions
the final
taxables
user.
ciblent
Excise
certaines
duties are targeted for
taxes
certain
relativement
taxes which
restrictives
have a restrictive tax base.
qui est aussi adapté
If we compare this to VAT, which is also a consumer tax, these are different instruments that allow us to collect higher taxes, which are both efficient. Why? Because from an administrative point of view, there are few costs. There are not that many producers rather, and thus allowing for easy tax controls and checks and reducing the choice of consumers. The objective is to correct the negative impacts of these different commodities. We're looking at taxes that could impact rather society, and we also are looking to internalize these external factors. In this vein, we increase the price of products using excise taxes so that we're able to then compensate or offset the different negative impacts of these products with the increase of the tax or the prices. We then have a societal level that is optimal. We have different types of products that can be um, subject to these types of taxes. So, fuel for different types of vehicles. We've also got different types of drinks and luxury products, but also communication services that may be private. The main are theoretically those that generate extreme negative external factors. For example, we could think about the environment, so negative impacts on the environment, and this is where excise taxes on fuels can then offset carbon emissions, and also they are complementary to carbon taxes looking at CO2 emissions. The idea is to facilitate a move towards less emitting fuels. We can also look at factors and internal and external factors linked to health. We could then talk about damages, long-term damages to health that individuals do have because of short-term consumption of some of these goods. Alcohol, tobacco, and sweet drinks are different products that are actually subject to excise taxes. And we've got different types of cancers or diabetes that have been linked to the three aforementioned products. This is obviously very toxic for public health. When we have excise duty or tax on these different products, we're able to reduce the consumption, but also this demand of these products, and thus have a positive impact on the um, illnesses that I just mentioned. We can have different types of excise duty or taxes. We can have ad valorem or specific. The first is looking at a fixed amount that is put on each unit of product, and the second is more a percentage of the price of the product. These two types of excise duties have different effects on the objectives that have been outlined, and these structures, and we also have hybrid structures as well that can be implemented in order to offset once again the disadvantages of both. And now I'm going to give the floor to the different panelists so that they're able to talk about the link between excise duties and also public health. Thank you very much for listening to me. And Anne-Marie, I will hand you back the floor now. Thank you very much, Anouk. Without further ado, let's ask Antoine Cazin, who is a tax policy economist at the Country Tax Policy Unit of the OECD. He will be giving his presentation which once again is very general, talking about the link between excise duties and public health. Antoine, you have the floor. Away you go. Thank you very much, Anne-Marie. Good morning, everyone. Good afternoon, everyone. I'll be sharing my screen. Obviously, this slideshow has now disappeared. We did do a technical check earlier, but I don't know why I cannot see my PowerPoint. Regis, maybe you could share the screen for me, please?
Voilà, donc le temps que Régis partage.
Whilst we're just waiting for Regis to share the screen, maybe I can whet your appetite. It's up to me to get the ball rolling this afternoon. I hope that these slides will be shown soon, says the speaker.
Alors, je vais peut-être commencer sans les slides. Régis, si tu peux m'indiquer quand les slides seront...
Maybe I could start without the slides, and Regis, you can let me know once you've managed to get them up. So I will start. We can talk about what Anouk was mentioning in her introduction, what are a couple of elements with regards to the objectives of health taxes. Why do we have these different health taxes? Why do we apply these taxes to these different products that can have a negative impact on our health? The first is to raise tax revenues. That's obviously the primary objective. You can have different jurisdictions that decide to increase taxes or to apply excise taxes in order to mobilize more tax revenues and better finance its public action. This is a strategy that can be quite efficient for different reasons, but especially because the different products that we're talking about, tobacco and alcohol, products that are quite elastic, which means that when we have an increase in the prices, we do have a slight decrease in consumption, but actually it doesn't really change the fact that people are still wanting to smoke cigarettes or drink alcohol, which means that we're able to raise tax revenues because people are still buying these products. Unfortunately, I'm still unable to share my screen. I hope that it will come, but let me continue. The second aspect here is that when we think about the objective of excise duties, health excise rather, we are looking for non-distortive impact. We don't want to have an impact on the producers or the consumers. However, what is considered as being virtuous in when we think about health taxes is to say that actually they can be virtuous because public powers are able to implement this type of tax with the objective of having a positive impact on economic agents. So here we're talking about consumers. They're going to be reducing their consumption of these products that aren't good for their health, and they're maybe going to turn towards more healthy products. And for producers, they're going to think about a different type of offer. Maybe they can look at more healthy products. We've also got tax revenue. We've got different expenses, it's public spending. When we talk about goods that are not good for health, we are also talking about the consumption of these goods that then have an impact on costs and public health, especially if we think about the health of the consumers themselves, but also their entourage and those who are around them, especially if we think about passive smoking or tobacco. These costs can be quite substantial because we're talking about obesity, we're talking about cardiovascular disease, or even respiratory diseases. These are costs that have to be then borne by society, therefore legislative bodies, and I can see that the slides are now up. Thank you very much. So the legislative bodies can implement this type of tax in order to increase the price of these goods to reduce the health concerns and also have a reduction of public spending from a health perspective. Therefore, we can have public funding that is a lot healthier and savings can also be made. We're still on the first slide. Anouk also mentioned that we've got other types of economic costs as well, or linked to violence or accidents, due to an excessive consumption of alcohol, for example, and all of these costs have to be borne by society. The legislator once again can use health taxes in order to internalize the external or the negative external factors that are linked to the different products that are of interest to us today, so tobacco and alcohol. We can also have these types of duties, the duties that we're talking about, in order to make the consumer pay a part of the costs that will then be borne by society linked to individual consumption of tobacco or alcohol. We have three objectives here that aren't exclusive, so they're completely compatible, especially on the short term, in the short term. We can go to the slide that is now on the screen. I'm going to quickly go through a couple of figures for revenue coming from tobacco excise tax. So we'll start with tobacco. This is the product that actually generates the most of this tax revenue. We've also got alcohol, and then we've got SSB, so sugar and sweet drinks. We can see that actually this is quite a modest chunk of the chart. What we can see from this graph is that revenue coming from taxation on these goods can actually go above 2% of GDP for some of the countries, but for other countries, this tax revenue is relatively limited or even marginal for those that are completely on the right-hand side of this graph. Next slide, please. Thank you. There we go. This one here. We can see that the countries have been put together by different revenue categories, and we can see despite the fact that there are a couple of similarities, tax revenue is mobilized, linked to taxation of these goods for about 1% of their GDP, which is about 2 times higher than for countries that are low income. So the first was for high income. The first two figures are quite stable. If we look at the past 10 years, between the two groups of countries, we have middle income countries that the tax revenues are actually increasing. This meaning that over the past 20 years, there has been an increase in the potential of tax revenue that is collected from these products that are not good for your health. And we have a last. What is being also suggested by this graph is despite the fact that we are seeing heterogeneity amongst these countries, there are a number of countries that do have a tax revenue potential that is unexploited. This is the case of low-income countries. If we move to the next slide. Here we go. So for this slide, what can we see? This slide actually echoes the costs that are generated by the consumption of these goods on health. Here we're focusing on cigarettes. What we can see is the healthcare expenditure that can be attributed to consumption of tobacco, and we can compare this to the taxes that have been placed on cigarettes. So we can see the fraction here that the different revenues, tax revenue represents for taxation. We can see that if you're following this, taxing is actually too low for us to completely internalize the costs that are being borne by society linked to consumption of tobacco. If we continue with the discussion now with the next slides, we're going to be looking at tobacco taxation in Latin America. This has actually been one of the focuses of the projects that have been led by the OECD. You can see the different justifications for why we need to increase and also continue with tobacco taxation in Latin America. We can see that the number of consumers of tobacco is extremely high in Latin America, and in the countries that we can see on the right-hand side, this prevalence is extremely high, especially amongst teenagers between 13 to 15 years old. The amount of 13 to 15-year-olds who are smoking on the right-hand side is higher than the adult population. However, we know that it's in these types of ages that behaviors are for addiction and for consumption are actually set. The second teaching is on the second slide. Thank you. We have learned that actually cigarettes are actually affordable in most Latin American countries, meaning that cigarettes or smoking is accessible to most of the population. The price of tobacco is not a barrier, is not an obstacle, does not dissuade from tobacco consumption. To be even more specific, when we look at this graph, we can see what percentage of your revenue it will cost to smoke cigarettes if we compare this to the GDP per capita. So you can see that this is for consumption of 2 packets of cigarettes per week. So it's a percentage of GDP per capita to purchase 100 packs of 20 cigarettes. It will be very high if you live in Jamaica. However, it's 1% of your revenue, if your income, if you live in Paraguay, which means that for most of the Latin American countries that you can see on the screen, the cost that is associated with cigarette consumption is quite modest when compared to income, individual income. Third element. Here we go. The third teaching is linked to WHO recommendations that the taxes should be 75% of the final price that is paid by the consumer. However, we can see that in Latin America, with the exception of the couple of countries that you can see on the right-hand side of the graph, most of these countries are below the WHO recommendation and by quite a way, which means that indirect taxes are too low in order to meet the WHO recommendations. The fourth and the last teaching, if we move on to this now, here, there is a revenue potential of tobacco excise taxes that is quite high, especially where there is a high prevalence. So this, you can see the prevalence with the different black squares, but despite this, we can see that tobacco excise tax revenue is relatively low, and this is represented by the blue bars. These 4 different teachings that we've got are 4 amongst many others that I unfortunately don't have the time to present, but this means that we need to really continue in thinking about tobacco excise tax revenue in Latin America, but also elsewhere in the world, and not just for tobacco. And to wrap up this presentation, I've just got a couple of points with regards to SSB excise taxes. Just very quickly, Antoine, please. Yes, absolutely. 1 minute on this, and then I will give you back the floor. So for SSB excise taxation, we've got this that is relatively new if we compare this to taxes that are placed on alcohol or tobacco. However, we've got more than 100 jurisdictions in the world that have actually put in excise taxation on these types of drinks. We have actually got few or not a lot of tax revenue that is generated, even though this is not maybe the biggest or the primary objective. This is not why we have these taxes on sweet and sugary drinks. We've got jurisdictions that are looking to change or to induce behavioral change for economic agents, so consumers and producers, in order to increase public health. And for the last slide, very quickly, I'll try and sum this up in a nutshell. You can see that when we think about health tax design options, it will depend on multiple factors, especially if we think about the objectives that have been set by a jurisdiction. This design, you can see the different parameters that were also spoken about by Anouk that are also on the screen. This will have different impacts on the behavior of the different agents that will be able to generate different reactions with the consumers and with the producers. These different reactions are also going to allow you to hit your objectives. Therefore, it's important to think about what your objectives are in order to have the right design of health taxes that's allowing you to hit that nail on the head. And with that, I will stop my presentation. Thank you very much, Antoine, and thank you very much for respecting the time that we give to you, more or less. Thank you very much, and we have a very general overview with regards to the OECD work. I think that Mario Monso will be now taking the floor. He is the division chief of the tax policy division at the International Monetary Fund, the IMF, and he will be presenting the results of works that were conducted by the IMF, by his division, with regards to this type of tax. And he will also be presenting an overview of the role played by the different actors, and he will be talking about 3 products here, as was mentioned. Mary, you have the floor.
Thank you, Anne-Marie. Can you hear me?
Très bien.
Merci. Bonjour à tous et merci.
So good morning, good afternoon. Thank you for this invitation. I'm here to talk about, to talk very briefly, those three publications done by the IMF on alcohol, tobacco products, and sweetened beverages. These are short notes, about 20 pages each, easy to read, should you be interested in knowing more. First, I'd like to put excise duties in the general context of gathering resources. Excise duties have an interest from the point of view of tax revenues. And on the left side of the slide, top left, you see the ventilation of countries depending on their revenues versus GDP ratio. And you see for low-income countries, for example, in blue, the concentration is around 13% of GDP, which is very insufficient looking at the needs of these countries in terms of public spending. For advanced countries in light gray, you see that the ventilation is very widespread, meaning that countries have a real choice in terms of determining their ratio revenues over GDP. It's easier to manage than in low-income developing countries. So there are intense needs, and the question we have, or one of the questions we have, is regarding the role of excises in public health policies. At the bottom left, you see the tax potential of low-income countries on the right. I won't bore you with all the technicalities, but basically what we've estimated is that there's a potential of 6 to 9 GDP points for increased potential in low-income countries. And looking at the methodology we used, I think those percentages are quite optimistic. But in any case, it shows that there should be a long-term objective over 2 decades to have an increase in 5% of GDP, and that's perfectly reachable. But it's not easy. Countries which have managed to do it shows that it's not at all easy to reach that task potential. The role of excise duties is on the top right graph. You see that excise, one way to measure the income generated by excises is to take the difference between indirect taxes and VAT. That's a way to have an idea of the amount of excises rather than measure them directly, which is always difficult, particularly in developing countries. And the result of the graph is that over time, revenues have decreased in rich countries, have increased in emerging countries and low-income developing countries, and we are around 2% of GDP for the revenues, with a slightly lesser amount in developing countries, around 1.8. Now, can developing countries do more? That's the $1 million question. And this, the answer depends on the country. There's no one-size-fits-all answer. Bottom right, you have the trends. Antoine from the OECD has already shown those learnings. There is a downward trend for revenues generated by excise on alcohol product, and an increasing, although more stable from 2010 onwards, on tobacco products. The reason for these stabilizations are due to substitute products to tobacco, which became very widespread in the last 15 years. And here we have a huge debate on tobacco products. What should we tax now that there are substitutes available? On the right of that graph, you see that for alcohol, revenues are higher in average income countries and not in countries with high income. If you look at the main trends, the role of excises on health, the idea is to have a substitution to excise that are not based on fuels, transition, economic policy, the excise policy show that today, well, since 2 decades, we have a decrease of revenues in excises on petrol and fuels. I have here the example of a few European countries, France, Germany, we're minus 50% compared to 2000. So the future is in excise duties linked to health. But is that very promising in terms of revenue and at what cost for the tax administration? What we see today is a fragmentation of the tax administration. You have specific excises for climate transition, but also for the main excise duties, alcohol, tobacco, sweetened beverages. And I think that we will soon uh, take over the experience of Denmark 15 years ago, that is to say, excise duties on fatty products. I think countries will have at one point or another to play around with taxes on fatty products. What are the main results of empirical studies? For tobacco product, it's quite well established in terms of damages and externalities. We have a lot of documentations. Internalities point to higher taxes than what is the case today. And for developing countries, the challenge is that there's a high availability and a lot of illegal trade. So how could those developing countries use excise as a health tool uh, rather than just a tax? For alcohol, the sanitary incidence is significant, but the connection between consumption and sanitary impact is a lot more complex than for tobacco. There's a slight increase over time of the rates. Um, the total revenue from alcohol excises are down. Uh, Generally, countries, for reasons unknown, use ad valorem taxes rather than using the internality side of alcohol products. What's also important to say is that just like for tobacco products, countries have put in place non-tax measures. For example, control of consumption, limitation of distribution. But in terms of alcohol products, illegal trade is limited to very few spirits. But in some countries, there's a high domestic production. For example, India, China, even in some countries in Africa, personal household consumption or production of spirits is quite significant. And in that case, taxes cannot apply and cannot deal with public health issues. Regarding sugar-sweetened beverages, we know about the risk factors, obesity, which have been documented in many countries, for example, United States and Mexico. But looking at the very nature of the sugar and its presence in the daily consumption of households, the sanitary impact is very complex to measure and to document. There's also a high elasticity of substitution. For example, beer without alcohol, and the potential revenue will remain well below that of tobacco and alcohol, even if you can tax sugar in terms of internalities. The income over time will be quite limited, too limited to generate a lot of revenues. Now, let me talk about taxes on alcohols. Uh, about the experiences done in the different countries and the lessons learned in the note we recently drafted at the IMF. The main lesson is that there's no one size fits all. It depends on the level of income, the cycle in the consumption of households, but also the objectives of the legislator. So there's really no panacea, no single recommendation that will work in every country. To give you an example, on the left, in those European countries, look at the difference between tax on one cigarette in blue. You see the average amount of tax in the price of one cigarette. And you compare that to the revenues, to the excise on alcohol, which is near insignificant and very stable over time compared to tobacco. So different choices are made in different countries regarding the relationship between consumption, internalities, externalities, and the relationships between excises and consumption. On the right, what you have are consumption of four big alcoholic categories, depending on the level of income in the country. And what you see is that consumption is relatively stable over the last 4 decades. With this one difference, if you look at spirits and wine, in rich countries, the consumption is going down, which is explained by raising awareness of individuals regarding the negative effects of alcohol. But there's also a shift in the consumption of young people towards mixed drinks, um, alcoholic fruit juices in various forms with low alcohol content. This is really a shift in consumption, and this explains what happens and the figures you have and the connection between alcoholic consumption declining and sweet beverages consumption increasing. To end, to finish on lessons learned from the work at the IMF, countries don't always have a clear idea or a clear goal for excises. They want revenues, but what beyond revenues? Is the excise there to change behavior, to increase revenues? It's not very clear. So really, you have to be quite clear as to the role for excise duties on behavior, income, or both. The health objectives call for more specific excises. How do you measure externalities, particularly in developing countries? And also, what is the role of multiplying excises, particularly in the environmental world? What's the effect of those excise duties on tax on a large base such as that? Will countries do more expenses by that? And the other very important question that we saw is the allocation of revenue. A lot of countries look at excise as revenues to be earmarked. Is that wise from a global income policy? There's also the question of coordinating with broader economic policy, non-tax, and coordination with non-economic policies. For example, we look today at what's happening at ECOWAS and the Western African Union. How can region coordinate their excise duties better in an economic region, for example? I'll stop here in order to leave space and time for the other speakers. Thank you, Mario, and thank you again for sticking to your allocated time. It's now time to give the floor to our guest, Zunda Shisha, who's directing project leader at the Knowledge Platform in South Africa, Cape Town University. He will give us an idea of what's happening in developing countries. And without further ado, I give the floor to Mr. Zundashisha.
Okay, so thank you very much for the opportunity to present this. Okay, yeah. So basically, I'm the program director for the Knowledge Hub on tobacco taxation based at the University of Cape Town. So just a little bit about who we are. Basically, we're part of the research unit on the economics of excisable products based in the School of Economics at UCT. We were appointed as the WHO Knowledge Hub by the WHO Framework Convention on Tobacco Control Secretariat and officially launched as a Knowledge Hub in 2018. A lot of the work that we do has been focusing on the use of economic tools for research in public health, primarily in tobacco control, which is what we've been focusing on related to taxation, but also quite extensively over the last couple of years, we've looked a lot at alcohols, sugar-sweetened beverages, as well as illicit trade in tobacco products. The work of the Knowledge Hub basically works around providing three types of services: workshops on tobacco taxation, technical assistance, as well as dissemination of different types of works on our website platform. So what I'll be focusing on is really the work that we do around tobacco work, which is under the Knowledge Hub. And really the starting point is this Framework Convention on Tobacco Control, which many of you might be familiar with, the Global Health Treaty, which came into force in about 2005. There are a lot of provisions within that treaty that allow parties to be able to reduce the use of tobacco products, but also addresses issues to do with the supply side of tobacco as well. We focus specifically around price and tax measures. So this has to do with taxation, obviously, but also any kind of other measures that might be applicable to raise prices and reduce consumption. The guiding documents for this really have to do with the what are called the guidelines for implementation of this Article 6. I've presented 4 of them here, but I think a lot of it really speaks to what the other speakers have already spoken about related to the design and the structure of different types of taxes. So for instance, parties are encouraged to consider implementing a specific or mixed excise tax system with a minimum specific tax floor. Related to the issue of product substitution, which I think Mario just mentioned a number of times, is parties considering taxing products or all tobacco products in a comparable way. So you're not having any kind of increases in one type of tobacco product versus another. And so, creating the opportunity for product substitution and that sort of thing. And then, of course, because we're advocating within the tobacco space, at least, to have, specific excise taxes, we know that these can easily be eroded by inflation and are quite, sensitive to that. So we need to be able to adjust these taxes on a regular basis, right? Potentially annually, and taking into account things like inflation and income growth and so on. And then, of course, under the guidance here for the guidelines for the implementation here, is also to dedicate a portion of these revenues potentially to tobacco control programs or potentially other healthcare programs. And of course, this would be within the context of whatever the country considers feasible within their context. So what do we know of taxes just in general? How do they work? What are the sort of impacts we expect? And these are things that I think I'm sort of presenting a little bit of what has already been said, but in a slightly different way, I suppose. So what we know of taxes, for instance, in terms of the impact that it has, in terms of the reduction that we would expect from an increase in the price as a result of these tax increases, we know that a 10% increase in the price of tobacco products generally results in a reduction of about 4 to 8% decrease in consumption. And this varies across countries. So in developed countries, the impact is slightly less, on average about 4%. In less developed countries or in developing countries, the impact is much greater, about 8%. But within countries, we also know that this impact is also quite varied. It's not the same across the entire population. So different groups have different types of reactions. So we know that higher reductions can be expected, for instance, among low-income populations or amongst the youth, amongst women and so on. And so we know that a lot of these reductions can be expected amongst these specific populations. I think it was Antoine that basically spoke of some of the costs that are related to NCDs and to the sort of the health related costs amongst all of these population groups. And we see that a lot of these costs tend to be borne by these specific groups, right? So increasing the excise taxes reduces these groups' consumption of these products, and in a sense protects them from the impending effects that they could get. I think it was Dobré that talked a little bit about the win-win scenario. I think with excise taxes, what we expect is that there will be a reduction in consumption. We consider this a win for public health. Because, as I said, this obviously leads to less negative public health outcomes, and it's basically, based on the law of demand in economics, which is the higher the price of a product, the lower the demand for that particular product, and that really anchors the impact that we expect from these types of products. But I think, as others have also mentioned, the fact that you're able to reduce consumption does not necessarily mean that revenues reduce, because the impact on the revenue side tends to increase, because the increase that you're expecting on it's the reduction that you're expecting from the consumption is not as great as the increase that you get from the price increases. So you're able to see a win on the fiscal side in terms of the government revenue that you get. So just looking on the tobacco side, and this may not be applicable necessarily to tobacco, but to other products outside of tobacco necessarily, but we sort of see a kind of hierarchy of tax structures, if you want to call it that, where uniform specific excise taxes and mixed tax systems tend to be the more appropriate or the best, considered best practice in this particular circle. Whereas ad valorem taxes and tiered tax systems are much more complex, much more prone to erratic predictions of revenues, as well as manipulation by the industry in various ways in terms of reducing the predictability of revenues for the country. So just based on that, we see that a number of countries still apply ad valorem excise tax systems. And it's really in this sort of space that we see that there's potential for them to sort of change the excise tax structure or consider changing the excise tax structure. And in that place, there's also potential for them to gain some kind of revenue as a result of that from those types of changes, depending on obviously what the rate would be. And so we see that most countries, I think most of these 40 countries will be in low middle income countries. And there's quite a lot of potential for those countries to be able to change their excise tax structure. We also see that there are a few countries that don't even have excise taxes or excise taxes for tobacco products. And in those countries, obviously, introducing excise taxes means there's a new line item in terms of the revenues that they could gain from providing taxes in those areas. This is a slightly similar graph to what I think Anton also presented. He used the WHO threshold of 75% of the total tax share. I'm using a 70% excise tax share as a percentage of the retail price, but it basically tells the exact same story. If we look at the share of the excise tax within the retail price of the most sold brands in most of the countries, there is a lot of scope for them to be able to increase those excise taxes and thereby gain excise tax revenue from that. And of course, this threshold doesn't really mean that countries can't go beyond that, because we see on the far right, several countries have already gone beyond that particular threshold. And so it's possible to go beyond that threshold as well as to be able to gain more revenues out of this these tax increases. And I think, stop here, but basically the point is to belabor the fact that there is still quite a lot of potential for countries to be able to gain domestic resources from taxation of tobacco products. There isn't a sort of one-size-fits-all. I'll echo a little bit of what Mariam has said, but basically there isn't a one-size-fits-all for all the countries, right? Some countries have already got the right type of excise tax structure that benefits them in terms of both the public health as well as the revenue impacts. And so in those cases, you don't want to change the excise tax structures. You want to potentially increase your excise tax rates depending on where they currently lie. And then, of course, in other cases, you have scenarios where there's a very high, dependence on the ad valorem component of the mixed systems. And so you want to shift that dependence onto to the specific components. And so on. And there would be similar sort of gains that you might be able to get from, for instance, improving the administrative aspects, which I haven't really spoken about here, but those would be additional areas where countries might be able to consider tightening the loose screws where they're able to gain some of the additional revenues from leakages within their systems and so on, and allow them to gain more revenue. But really, the aim of these taxes is obviously to save lives. It promotes health equity because it targets these vulnerable groups that I mentioned earlier. And of course, it's able to generate quite a lot of revenue for different countries in different contexts. Yeah, I welcome any questions or comments, and thank you very much for your time.
Merci beaucoup, Zunda, et pour cette intervention. Thank you, Zunda, for this interesting presentation. I think that all three presentations that we've heard so far show qu'une solution pour faciliter un peu la réflexion et les tâches, c'est de se mettre ensemble.
Maybe a solution would be for us to work together. And this is exactly why we're going to move on to the last speaker of the day, who will be showcasing just how important it's important for us to look at regional coordination. Why? Because this allows the different states to think together on the best practice and able to find tax solutions for these products, and also in order to avoid any tax issues between neighboring countries. I'm going to be giving the floor now to the Director of Customs and Taxation of ECOWAS, Mr. Sarufo Tiemtore, who will be presenting the example of ECOWAS with regards to excise duty. Mr. Director, you have the floor. Thank you very much, Madame Anne-Marie. And thank you once again for having invited me to take the floor to participate in this panel. I would also like to thank my co-panelists who have actually made my life a lot easier. So Mr. Ghazal, Mr. Mansour, and Mr. Shisha, because thanks to them, they've really set the scene, and it was a good segue into my presentation. I completely agree with the different points that were raised by my panelists. And I would like to talk to you about what we're doing at ECOWAS. We cannot talk about excise duties without talking about health. Even though at the beginning, this wasn't our objective. Our objective was actually looking at tax harmonization, especially from a VAT perspective, because we know that the VAT was really the flagship tax of the 1990s. Therefore, we started working on VAT, and following this, we decided that we wanted to harmonize excise duty so that there was no discrimination against the different states. Therefore, our objective was only at the beginning to look at harmonizing excise duty, and this is why we worked with different African states. We wanted to be able to look at the different resources available in order to mobilize further tax revenue. We looked at the different products that should be subject to excise duty, and we didn't want to have just all these products being thrown in. We wanted to put in a framework for tax rates as well. We were all in agreement that all of the different countries or member countries of ECOWAS that should be using an ad valorem basis. This for us was very easy because the first directives, the first guidelines that came out of ECOWAS for excise duty were elaborated or developed on this basis. We also wanted our member states to ensure that alcohol and tobacco were mandatorily subjected to excise duty. And for the rest, it was optional. If we think about the relationship between the states and excise duty, if I move to the 1990s, the end of the 1990s, when we started working with the WHO, as Mr. Shisha mentioned, we there was a research firm based in Senegal, but we also were working in Brazzaville. The center in Dakar looked at this issue as well. We therefore worked together in order to find a connection between excise duty and a solution to looking at reducing tobacco consumption in West Africa. We worked with this firm who conducted a lot of research. And we came to a scenario where the state was one of the solutions in order to ensure that tobacco was less accessible to the African youth, and we wanted to ensure that the youth who are often targeted by tobacco campaigns couldn't access tobacco. Therefore, excise duty allowed us to do this. We also came to the following conclusion. Ad valorem tax was the best option for us. Why? Because there's a lot of value that is added to this, which means that when we increased tax rates, if you don't have a hand over the value of the merchandise for which you're trying to increase the tax rates, it could be quite complemented. Therefore, we decided that wasn't going to be an option. We wanted to have a specific tax for our legislation. So we looked at the ad valorem option. We decided that even though this may seem like an option, it wasn't the option for us. And therefore, we looked at a specific tax. We know that there is a lot of tobacco production and that tobacco producers were using the different networks. But we were trying to overcome the blockages that we were seeing following WAMU emitting its own directive with regards to excise duty. There are some states that were able to take into consideration the possibility to introduce specific taxation to their legislation for tobacco. It was a huge success story, and we thought that we were going to be able to start forcing states or obliging states to have excise taxes for tobacco. So we were saying that they would even have to put this on cigarette packaging. This endeavor was relatively efficient. If we think about the quantity of tobacco produced, but unfortunately, we weren't able to go any further than the directive in itself. Because even within ECOWAS, we didn't have full political support. So as Mr. Mansour mentioned, there aren't any clear directives with regards to excise duty on tobacco. We understand that there is a health aspect, but there is a total separation between the health ministry and the trade ministries or even the finance ministries. And the fact that these three ministries are working in silo means that it's very difficult for us to have tax rules that are then being linked into public health. Unfortunately, finance ministers are more focused on budgets and customs than taxes, and they're not very open to changing tax rates easily. There was a lot of reluctance when we started talking about a regional approach. And actually, the health ministers were one step ahead of the game in all of the different ECOWAS countries. But unfortunately, these same health ministers had little influence on the financial tax decisions taken within the same jurisdictions. Often it was the Ministry of Commerce and Trade that was an industry that were looking at the taxing these products with the finance ministry. But unfortunately, it was a very narrow viewpoint that was being taken, and they weren't considering the healthcare elements. This is why we came up against a couple of barriers within the different countries, because there wasn't a nationally drawn out policy taking into consideration both the healthcare aspects and also tax revenues. We know that healthcare or health ministers are fighting for this to be taken into consideration, but they haven't yet got there. So there you go, in a nutshell, what we're currently facing in ECOWAS and in the ECOWAS region. Just to come back onto the other products, so we spoke about alcoholic beverages. For alcoholic beverage, they fall into this bag, but there isn't a link between the tax rate or the level of taxation and healthcare. There are no studies, there are no studies, there's no research that has been conducted. So unfortunately, we don't have a lot of data to work with here. The same can be said with pollution and the environment. From a regional standpoint, we haven't yet been able to produce clear results because no studies have been conducted. In other countries, I know that this is the case, but for us, from a regional coordination point of view, we don't yet have this matter to work with. The same can be said for sweetened and sugar goods, drinks. We want to be able to have taxation on SSB, sugar sweetened beverages. But unfortunately, we haven't yet been able to get to the end of this project, even though there is a World Bank project that is in the pipeline for Africa looking at SSBs. What I can say, however, is that in conclusion, we also are suffering on a regional basis due to an absence of clear cohesion with regards to excise duty. Even though we do have directives and guidelines that have been developed within ECOWAS, trying to link taxation or excise duty and health matters. Unfortunately, this connection between political will, financial political will, and healthcare has not yet been, or public health has not yet been strengthened enough. And maybe what we would need is to double our efforts and actually work together in order for us to engender real change within the region. Without this, it will be very difficult for us to really bring together all of these different trails of thought. I just want to finish with something that we are trying to do within the region. We've encountered a lot of difficulty, but a lot of success as well. In West Africa, it is difficult to fight against tobacco producers because they're saying that we can't increase the excise duty because this says that it would mean that there would be an increase in fraud as well because people would not be respecting these, and they say that it would maybe contribute to the counterfeit markets or the illegal markets. We are trying to implement actions to fight this. The idea is that when we're able to see cigarettes, we need to know where they've come from within the region so that there is no black market for cigarettes. We haven't, unfortunately, received the support that we would need to fight against this illegal market. So there we go. Those are the different difficulties or the challenges that we as ECOWAS have faced in the West African region when it comes to excise duty and public health. I just want to finish, if I may, on one point with regards to the efficiency of health of excise duty. The government decided to use excise duty in order to increase tax revenue. This, for example, with alcohol. But when we see the results and the resources that are mobilized, it's about 100 safer for a bottle of beer, which means that regulations have been put into place, but actually the prices have completely skyrocketed. And this isn't a method that is accepted or acceptable. But if we think about Nigeria, it's the complete other end of the spectrum. We have no excise duty. I think a packet of cigarettes is a couple of euros for a packet of cigarettes in Nigeria. This is really what we're having to face in the region. Thank you very much. I hope that I didn't speak for too long, and I hope that I respected the time that you gave to me. Thank you very much for listening. And I'll stop there. Thank you very much, Mr. Tiamtore. It was very interesting to hear about what's going on in ECOWAS, and you've gone above and beyond just the question of coordination because you also highlighted the difficulties that you are facing with regards to political will when it comes to these types of reforms and measures that should be taken in order to improve public health with decisions that are taken by the finance minister and others. And we have finished with the different presentations from our four panel members, and I am going to ask the different members if they've got, of the panel, if they've got any questions for their colleagues, and then we will be giving the floor to the participants. We're going to be starting with the panelists. Do you have any questions for your fellow panelists? And following this, we will go to the audience. Who would like to take the floor? Mario, away you go. Questions? Go ahead. Yes. So my question is about the opportunity to further increase tax revenue for tobacco goods. So we saw the graph, we saw that there is a threshold from a global standpoint. This means that we have reached, well, we saw this from the graph that Mr. Shisha showed us, that we've got rates that are very, very high in certain cases. But if we think about the countries that are below 75, does this mean, or 75%, does this mean that they're unable, these countries are unable to increase these taxes from an institutional point of view? Or is this for geographical reasons? And do we have a point of view for taxing tobacco substitutes as well?
Thanks, Mario. That's a great question. I'll go back to your comment around there's no one size fits all, which I think applies pretty much to that graph. Each country is obviously facing its own issues. And so typically when we approach countries with, or what typically happens for us is when a country approaches us for assistance, they're trying to figure out what do they do about tobacco taxation in their country. And they want to increase the excise tax, or they want to change the excise tax structure. Our first point of call is obviously to understand what's going on in the country broadly, from a political standpoint, from an economic standpoint, and put all these pieces together, try and understand what's the most feasible option for the country in front of them. And so a lot of times what we see is that a lot of this comes down to political decisions. Many countries have the possibility to increase the excise taxes, and in some cases even change the excise tax structure, but they're juggling a number of things. They're trying to make sure that they're not upsetting the tobacco industry in some cases, who've told them a number of different things about what will happen if they increase the excise taxes or if they change them in a particular way. And so what we try to do is to present them with modeling, exercises where we develop an excise tax model. We try and show them this is what would happen based on these particular principles. And the modeling exercises are pretty standard. It's based on economic principles. We have a team of researchers that come up together to gather the information that's needed, put them into this model, and show them what the likely impact would be if they change them based on different scenarios. And we do this in collaboration with the different countries. But again, it's on a case-by-case basis. Some countries have a stronger political will, but they're not sure about what the impacts are likely to be. And so if we present them with this information, they're able to move forward with it. In other countries, the scenario is quite different. They're not really interested in gaining any kind of revenue. They just really haven't thought about the public health role that these excise taxes could actually play. And so by bringing ministries of health together with ministries of finance, some of what Mr. Tim Torre, mentioned, the siloed workings within these ministries, those barriers start to come down because they start to see the potential of the tool that's in front of them to be able to help reduce the public health burden that they're seeing. And so by presenting some of this type of evidence to policymakers, they're able to sort of get the sense of what's actually happening. And then your second question, I think, around substitution. Yeah, I think the big guidance, the main type of guidance that's been given so far is that you want to basically tax, tobacco products in a comparable way. So for instance, in some countries, you have roll your own tobacco versus, cigarettes, for instance, which would be considered substitutes. If you increase the prices of cigarettes, some people might switch to roll your own, which is not as much of an expensive product, but if it's not also going to be increased, if the taxes on that are not going to be increased, then it's possible that people simply substitute to that. So when you're basically structuring the taxes, you make it a uniform specific sort of tax. So it's uniform because it's being applied across the different types of tobacco products in the market. So if you increase your excise taxes, you're not just increasing on one type of tobacco product, you're increasing it across all the different types of tobacco products. That's been generally the kind of guidance we've given countries. And of course, on a case-by-case basis, we try and understand what the situation actually is that either prevents that from happening, or what sort of issues might arise if they don't, or if they do apply that particular advice. Yeah, that's my comment. Thank you.
Merci. Est-ce que quelqu'un,
Thank you very
Antoine?
much. Is there anyone else? Antoine, would you like to take the floor? Yes, I just want to, it was a very good answer that was given by Zunda, but maybe I could bounce off with a question of my own here. For Mario's question, it's also very important to think about the interpretation of the different aggregated measures. As Mario was showing, we do have a plateau of tax revenue linked to tobacco, but this from a very aggregated standpoint. And this can actually hide a bit of the heterogeneity that we could see within the region. What Zunda showed us in his presentation was that from an elasticity point of view, we've got elasticity that is relatively low for tobacco. Therefore, there is a potential for tax revenue linked to tobacco that is not exploited. Once again, we could have heterogeneity within countries, but if we interpret the level of fiscality between the countries, Mario came back to a recommendation that was made by the WHO, the 75% threshold that was set. We also need to think about how we are going to interpret this. Even if we've got an element of taxation that is quite high from the final price, this doesn't necessarily mean that the price is going to, or the tax aspect is high enough. So Brazil is a tobacco producer, and we've got a lot of tax measures in place and a lot of waivers actually for tobacco producers. Brazil actually finds itself with a production cost, which are very low. So even with a tax element that is quite strong, when we think about the final price paid by the consumer, the final price is quite low in general. Therefore, it's not because we're hitting that 75% threshold that taxation is high enough and cannot be strengthened further. Therefore, there are a couple of gray areas here. I think we do need to be careful when looking at all of this together. And I just wanted to mention this. And then following, if I can bounce off with a question of my own. Within our different discussions, developing countries were at the heart of all of our presentations, and going above and beyond just tobacco, but just excise tax or duty linked to health. I would like to ask the other panelists what the obstacles that they're seeing, what are the barriers that they're seeing. We know that excise duty linked to health generates public revenue that isn't very high. Actually, it's a lot lower than middle income or high income countries. However, in developing countries, this is where we have the lowest tax rates, as Mario showed. And it's also in these countries where it's more difficult to tax other types of goods. For example, fortune or revenue because of the informal market. Therefore, I wanted to ask my other panelists, what are the barriers, what are the obstacles are you seeing with regards to developing or increasing tax revenue linked to the products that we've spoken about? And what are the different points of leverage that we could use in order to try and exploit that potential or tap into that potential? We've spoken about a couple of barriers, but maybe more generally, I'd like to ask my other panelists, what are the obstacles and what are the points of leverage that we can use to increase revenue in developing countries for these products that are not good for health?
Merci. Oui, c'est vrai, ça complète tous les obstacles déjà mentionnés par. Yes, to add to the hurdles already mentioned by Salifou Tiemtore. Anyone wanting to add something? Mario?
Merci Anne-Marie.
Thank you, Anne-Marie. I think that in principle, in developing countries, there are less obstacles. For those taxes, very often there's a high concentration on the volumes. So if we tax the volume, it should be easy, particularly for products that are difficult, how should I say, that are not subject to illicit trade or informal economy or illicit production. We forget that taxes on sweetened beverages were first used in developing countries well before they were introduced in developed countries, precisely because the companies producing them, beer, for example, would also produce sweetened products. So that's an important leverage. In terms of hurdles, obstacles, there's the difficulty of having a specific tax, which always aims a small number of producers and therefore more subject to lobbying of big multinational corporations. And for some products, such as cigarettes, Antoine mentioned the very low price in some places. So we need to have much higher taxes to have an incidence. And to tax at that level is very difficult in developing countries. To increase the price of a cigarette is very difficult. So in that case, taxes are not going to play such a significant role, and there is a need for additional policies. So these are some ideas regarding the hurdles. I had Maybe a question, sorry, Zunda, just my remark, and then I'll give you the floor. Are there any studies comparing the efficacy, the efficiency in terms of health improvement to compare the efficiency of excise with other prevention means, such as prevention campaigns, awareness raising campaigns? Has it been done? Is it available in developing countries? Maybe Zunda has an answer, or Salifu.
Yeah, I could start. For the tobacco side, one of the things that we have on the on our web platform is an e-library that has quite a lot of information about the impact of taxation on a number of different things. It's cataloged into the impact on the youth, impact on low-income countries, high-income countries, different sort of catalogs and different sort of categories of the impact of taxation. We've got over 1,000 articles on this e-library, and we're constantly updating it on a regular basis. And within that, you'll be able to find quite a lot of information about, the studies that have looked at the impact of these taxes or excise taxes or tobacco taxes specifically on various types of health outcomes, as well as I'll call it the effectiveness, the cost effectiveness really of these types of interventions. I can't really speak necessarily to alcohol or SSBs, but I believe that there are some studies out there that have actually looked at the cost effectiveness of those types of taxes as well relative to other types of interventions. But if I can just go back slightly to the earlier point I was going to raise, which was to do with the issue of the hurdles. I wanted to just touch again on this issue of the political economy, because I think that's where, in my view, a lot of the rubber hits the road, essentially, because you can do all the modeling, you can present all the evidence, you can talk to the Minister of Finance even, but ultimately the decisions are made at the political level. And so if we can get a scenario where the people that have the decision-making power within each of the governments, the ministries of finance and so on, to be able to help them understand the need for a particular change in the tax structure, or the need for a particular change in the excise tax rates. That, I think, would be our point of call generally in most countries. I think the understanding the dynamics, the concerns that they have, the issues that they're juggling, those are the issues that we need to be able to address to help them see how to best make a particular decision around health tax reform in their countries. That would be my take on some of the challenges in there. Thanks.
Alors, pour ajouter quelque chose à ce que M. Zunda dit, nous on a été...
Add to what Zunda just said. At the time, a study was done in South Africa showing that with the increase in tax, you had a decrease in consumption, and this was measured. But I haven't seen studies in other regions where there's a connection between the increase in the tax or the reduction in consumption or non-tax measures put in place. Maybe in Senegal, there is something. I'm not sure, but maybe in Senegal, there are studies. For the rest of Africa, I have no knowledge of such comparative studies. But what we have in place in Western Africa is not efficient, because from a customs point of view, there's fraud on the value. So if you tax a product 75%, 80% on the wrong value, there's no incidence, because we're not controlling, we're not checking the value. But if you tax on quantities or on volumes, you're told that there's a lot of resistance to that type of structuration. Also, in Western Africa, I think in Cabo Verde, there is proper taxation. If you look at Nigeria, to measure the percentage of excises in general revenues, it's negligible, and it shouldn't be that way. Maybe on one product that we haven't discussed here, which was discussed in the region, energy drinks, very often very sugary. Energy drinks, sports drinks. This is something that we've added to the list of product to be submitted to excise. And we went even one step further. We want these energy drinks to be taxed at the highest level recommended. So this is a recommendation, something to follow. Thank you, Mario. Mario, you want the floor? Thank you, Anne-Marie. I simply wanted to note that most of the questions we see on the chat talk about resource allocation, about resource earmarking. And this is what I meant when I talked about the economic policy on excise duties. In the different countries, even in advanced country, we see specific tax as an allocation to specific expense, which is a handicap, which is a drawback. Before allocation is an obstacle, generally speaking, practically speaking, to a proper design of those tools. And it's an enormous issue for developing countries. Those that need all those departments in the ministries to look at the expense. If you have to look at expense, you should look at the way you do your budget rather than rely on changing taxation, because it's fundamentally an economic issue. In developing countries, it's all the more important because the ratio is low, because the income, the receipt is low compared to a country such as the United States, where there's a lot of allocation of income, including excise on oil products, which is very low, as I've shown. So if we don't deal with that issue, I doubt very much that taxes on tobacco product in developing countries can increase above 70%, for example. So maybe, Anne-Marie, I'd like to move and shift the debate on that issue. Thank you, Mario. Mario, did you want to add something? I have a short question. Can I ask it? I think Mario has opened the floor already. So it's a question maybe for Mario. We talk about indirect taxation, but I wondered what role for direct taxations, for example, on exceptional profits for the tobacco industry, for example. How do we combine both? What about the role of direct taxation? Mario, quickly? Quickly, I think that a direct taxation of profits above the yield of capital specific to a sector is very difficult to implement. For example, Europe during the COVID. Look at what happened in Europe during the COVID and the increase in the price of energy products. Of course, the exception is extraction. It's a very different industrial sector from all others for reasons well known. But for the rest of the economy, if we want to add direct tax to indirect tax, for example, with a tax on excess profits, for it to be credible, we have to do it for everyone and not just for one sector in particular. So we're back to excise duties. Among the questions we have in the chat, there's the list of products submitted to excise duties, because Mario, you talked about fatty products which are taxed in Denmark, and there's a question regarding the possible taxation in Africa for some cosmetic products, because you will remember a number of warning about whitening products, skin whitening products that have an impact on health. Do some countries already apply a tax to limit the consumption of such products? And also among the questions, could other products also be submitted to excise duties? For example, cannabis, if it were to be made legal. So on cosmetics, someone wants to answer? Someone has an answer? Well, within ECOWAS, yes, cosmetics. For public health, with a public health goal, no. We give the possibility to state to tax cosmetics. They can use it for sanitary goals. So you leave the possibility, but it's not compulsory and it's not directly. It doesn't have any compulsory character. Maybe another question for you, Mr. Thiemtoré. You talked about the difficulty to have mixed structure of taxation, to have specific taxes levied on tobacco products. In WAEMU and ECOWAS, it seems that there's like a conflict of legislation regarding tobacco, because two directives were taken in December 2017 on tobacco products. One in the WAEMU and the other one in ECOWAS, with a mixed structure ad valorem plus specific. So how does that work pragmatically, practically? You're right, Anne-Marie. We prepared the directives from a technical point of view. Both offices at ECOWAS and WAEMU, we had the same projects at the time, 2017. But there was a political question about the quantification, and the political aims were different. For ECOWAS, it was possible to have a more specific directive. But we live in a region where we are used to working in duality. So when there's a possibility, they use one directive or the other. But we should really end up with a similar directive. I mean, political questions are not easy to solve, always easy to solve. So we have different texts. The sound is very bad. That's the interpreter speaking. I can hardly hear him. Thank you, Mr. Thiemtoré. Clearly, implementation has to be improved, but it's a success because you've introduced more details in the directive from ECOWAS. Do we have, I'm looking at the chat. So again, many questions on the allocation, on earmarking. Ah, the microphone has gone. The microphone has gone. Anne-Marie's microphone is off.
Anne-Marie, ton micro s'est coupé en fait, on ne t'entend plus.
So in the chat, so many questions on the allocation. And one question, do some countries have specific accounts for health expenses that would collect excise duties and then affect them specifically to health? No example of specific allocation? No.
Il y a d'autres questions que vous souhaitiez mettre en discussion ou est-ce qu'on
Any other questions that you would like to ask? I'm just checking the chat quickly. So the implementation of the ZLECAf, we did have an incidence on all the issues that we've talked about, also from subsidy to taxation. I don't think that tobacco, alcohol, or sweetened beverages are subsidized in many countries. It's mainly talking about excise duties on fuels, but we had voluntarily left fuels and petrol out of this webinar. If the panelists have nothing else to add, maybe we can close this webinar. It's very interesting presentations, very interesting exchange. And on behalf of the FERDI and on behalf of the Platform for Mobilization of Resources, I'd like to thank our 4 speakers for accepting our invitation. And thank you for having worked to prepare a presentation to fuel our exchanges. Of course, we haven't solved the problems, but at least the discussion was interesting. And we will probably have another opportunity to exchange our views because we often organize webinars with the platform. So thank you very much to the panelists. Thank you to the listeners, and see you soon for another webinar. Thank you, everyone. Bye. Bye.